Hello, I'm Dr. Nilofer Mansouri. I'm one of the doctors working at Queen Alexandra Hospital, Portsmouth Hospital NHS Trust. I'm presenting the audit on evaluation of frailty assessment, management practices, and patient outcomes in patient under 85 years of age, a two-cycle audit conducted at Queen Alexandra Hospital. I'm presenting this audit in behalf of my team members, conducted under supervision of Dr. Golam Yahya. So, the reason why we conducted this audit is, as we all know, frailty is significantly affecting our elderly population, and it affects the patient outcomes in this age group, such as increased length of stay in the hospital, frequent readmissions, and deconditioning. At Queen Alexandra Hospital, patients under the age of 85 are admitted under the care of general internal medicine, so they often lack regular access to inpatient frailty services. So, this audit aimed to evaluate frailty assessment practices and management practices in these age group, and also to check the effects on the patient outcomes. Mm, this was conducted in two cycles, and between the two cycles, interventions such as staff education, applying posters on wards, and implementation of Frailty MDT were introduced. We used a retrospective method of data collection in two cycles. First cycle was conducted in January 2024, and second cycle was conducted in August 2024. We used patient case notes and uh, data available retrospective data from all the patient eligibility criteria was patients under the age group of 65 to 85 admitted under GIM. Evaluation was done on parameters such as patients evaluated for CFS on admission, CGA practices, CFS documentation by healthcare professionals, specifically doctors on in the patient notes. We also had a look at the proportion of patients having CFS 5 and above. We evaluated outcome of patients such as a number of readmissions and advanced care planning. Results. Frailty management was significantly improved. Significantly, progress was noted. Um, Compliance with frailty assessment on admission, that is CFS score, increased from 76% in the first cycle to 94.4% in the second. Um, Frailty detection, the identification of frail patients, that is, patients with CFS score of 5 and above, improved significantly from 36% to 75% in the second cycle. Documentation by healthcare professionals, it was a marked increase in documentation of up to 34.5%. Advanced care planning, despite improvements, advanced care planning for frail patients remained at 3.3%. Readmission rates, high readmission rates persisted, with 56.6% of frail patients being readmitted within the same year. As you can see, CFS assessment on admission increased from significantly. CFS documentation in the notes also increased. Hence, we increased the screening of frailty, but we still need to work on management practices such as advanced care planning, and to look into methods how we can prevent them from having recurrent admissions. So the conclusion is that audit shows significant improvement in frailty assessment, detection, and documentation, with high compliance in CFS in particular. Targeted interventions have been effective in some of the wards. However, challenges remain, particularly with the low advanced care planning, and we need some strong frailty management strategies to reduce high readmission rates. Recommendations. to implement strong policies for all the doctors to document CFS in the notes, and all doctors to carry out conversations about advanced care planning early in the patient's journey, and an easy and simple direct way to for all the doctors to document advanced care plan. So further education of doctors on conducting comprehensive geriatric assessment and actively participating in frailty MDT meetings. To conduct further audits to examine the proportion of patients being admitted with frailty syndrome and its association with frailty patient prognosis. Another important recommendation is to prioritize triage based on frailty over age to improve care and resource allocation. Thank you.